and this is kind of part of the assessment that we did, you're going to keep your left leg straight on the floor, and you're going to bring your right hip, knee, and ankle up to 90 degrees. And I'm going to always give lots of options with this. So there's a couple options here. One, you could bring your hands on your pelvis. Remember, we're trying to keep your pelvis motionless and move your thigh in the socket of your pelvis. That's option one if you want to help give yourself that feedback and make sure you know where your pelvis is in space. Number two is you could actually hold your thigh like at the top of your knee if it's hard to just hold your leg here in place so that you're kind of almost assisting your leg in this position. That's okay as well. But what you're going to think about is keeping your pelvis nice and motionless. You're going to think about your right thigh pointed straight up to the sky the entire time. My favorite cue here, you're going to think like your thigh is a rotisserie chicken. So you're literally just rotating it on an axis. So we're going to start with external rotation first. It's a little counterintuitive, but your thigh is going to rotate out and your foot's going to come in as a result of that. It's almost kind of like if you've done yoga, it would look kind of like a pigeon pose-ish kind of thing here. And that's just your external rotation. And then you're going to rotate slowly to internal rotation, the opposite direction. Thigh rotates in, your foot comes out. And just be careful as you go there to not go into any pain or pinching. It's going to be the golden rule of Kinstretch. Don't push into pain or pinching. And just go as far as you can go without your pelvis moving. We'll go for about 60 seconds of just exploring the rotation of your hip, keeping your thigh vertical, keeping your pelvis motionless, and just trying to connect your brain to the deep tissue in your hip. So a lot of times that's kind of a dead zone for people where they're not really used to using those muscles. So the first goal of this is really just to get a little bit of increased awareness into what those muscles feel like when they're working and rotating. You might feel when you go to that external rotation, maybe some inner thigh, inner groin, maybe some deep glute. When you go to that internal rotation where your foot comes out, you might feel more like front of the hip, side of the hip. You might even feel a little crampy. Crampy discomfort is normal and can stretch. Pain and pinching, not normal. So go to the point where there's maybe a little discomfort, maybe a little crampy feeling, but not pain and pinching. We'll go for about 10 more seconds. If you need a break at all, feel free to just drop your foot, come back into it when you're ready. We're just kind of warming up the hip, connecting our brain to that area of your body, getting a better sense of where it's at in space. And this is a good assessment tool as well as to how much internal, external rotation your hip has. Awesome, guys. Let's go ahead and relax. Take a second here. And then we're going to just go right into the same thing on the other side. So right leg is straight. Left hip, knee, and ankle are all at 90 degrees. And then just taking your time, same thing, getting that good rotation, trying to feel the deepest level of your hip. And I would say the main compensation or the easiest way to kind of get out of your hip on this is when you go to hip internal rotation and your foot goes out. Your pelvis on that left side is going to want to hike up a little bit. So just taking your time when you get to that end range of internal rotation to kind of stop right before your pelvis starts to move. And you could, when you feel pretty confident that everything's kind of locked in at your pelvis, you could find your end range of rotation and even fight for a little bit more. Now that we're a few reps in, we've kind of warmed things up a little bit, really work on expanding that range of motion, squeezing, putting a little more effort into the hip. Again, just kind of feel that out. The intensity can be 100% dictated on how you're feeling right now. Generally, this can be something where you're going just very light and just getting some rotation in your hip, or you can really want, if you really want to train your hip, working that rotation. I know we've got some golfers in the room as well. So just kind of applying this rotation to things that you may do outside of this class in particular, thinking about how your pelvis rotates around your femur on backswing, downswing, and that rotation at your hip. If you're missing rotation at your hip, Your body's just going to find a less effective, efficient way to move. Last couple seconds there, guys. Great question. How far should we expect to move it? There's normals. Go ahead and relax, guys. Awesome. There's normal ranges, so to say, as like orthopedics and stuff will say, hey, 45 degrees each direction. Your shin from the start is 0 and going out 45 here, 45 there. Personally, I kind of like to say, hey, what are the activities you like to do? What are, if it's golf, if it's cycling, if it's gymnastics, whatever it might be. And then from there, how much range do you need within that particular activity to safely be able to perform that movement? So if you're a golfer and maybe you have 10 degrees internal rotation, eventually that's going to break down and you'll have either some sort of hip pain, low back pain, knee pain, whatever that might be, because you're asking other parts of your body to also be a hip because you've run out of hip. So good question. Yeah, it's really just how much range do I need dependent upon what activities that you're doing or that you want to be able to do. So, okay, guys, we are going to get into a little bit of increasing range of motion. So here's where you'll need your chair and 2 blocks. And I'll do kind of a quick little demonstration of this and then let everybody kind of find the position that's going to work for them. But we're actually going to be lying on your side right after everybody got up. Sorry. But we're going to be lying on your side. And this chair is actually going to be kind of down by your feet. Now, the position, and everybody can kind of lie on whatever side you want to start. But the position here is going to be hips, knees, and ankles all stacked with a block between your knees. And you can have that other block either be for your head, or we may actually have that other block come up on the chair. We'll kind of test to see what we're looking at here. But what you're going to do is lying on your side with everything stacked, you're going to pull a little bit of space between your bottom side abs and floor. And then keeping that little bit of space, you're going to do an internal rotation of your hip so that your foot lifts up off of your bottom foot. And from there, you're just going to kind of take a mental snapshot here of how high your foot can go. And if it's a little bit below the chair height is going to be perfect then to set your foot on top of. If you're getting way above the chair without losing that space between your bottom abs and the floor, that's where you can bring that second yoga block in, set that on top of your chair or pillow if you're at home. And then you'll have a little bit more height to work with here. And then you'll just keep your top knee bent and just set your foot up on top of that block. So a couple different options. If you got a lot of range of motion, I would go block on top and set your foot there. If you're barely lifting above the chair, then I would just say setting your foot on the chair is okay. And then from here, you are just going to take a couple big deep breaths and just relax into this position. And what you were thinking about as you're relaxing into this spot is creating a little more space between your bottom side abs and the floor. And what we've just done is wound your hip up into internal rotation. So literally you're doing the same movement you just did lying on your back, but now you're in this kind of relaxed position in internal rotation. So we're essentially stretching out some of the hip muscles. It may not feel like a traditional stretch, but we've moved you beyond what you could actively lift up into so that you're into kind of a passive range of motion, we call this. And then from there, you're just lying on your arm, or if you don't have a block for the chair, you could lie. Looks like everybody's got a block though, nice. And we're just breathing into this. Slow breath in through your nose, and an even slower exhale out as you're breathing. See if you can relax that top leg, relax the top hip, any sort of tension that top hip is holding on to. See if we can let that relax a little bit more. Everybody's looking good here. And then as you're breathing through this, I'll kind of go through the procedure. We're going to do some contractions here. So one of the things that we're always talking about with Kinstretch is improving range of motion. Oftentimes, it's not that our muscles and tissues can't stretch further. It's just that our brain has this governor system, just like in a car, there's a governor system that says, although the car can go faster, we're going to make sure that it only can go this fast. So it's the same thing with our body. Our brain puts on this governor system, says, although you can stretch further, I don't trust that you're going to be strong there and resilient to injury there. So I'm going to stop you there. And the way that we can then increase range of motion is contract certain muscles. And that will then allow us to convince our nervous system and our brain that, oh, hey, they just proved I was strong there. And then you could be able to go a little bit further. So that's what we're going to do here is from this position, you're just going to try to contract your hip muscles and just kind of squeeze them a little bit. Doesn't need to be hard. Just think about your deep hip muscles. You're just trying to squeeze them a little bit. And then we're going to create a little more tension elsewhere. Thank you. So from here, as you're squeezing your left hip just a little bit, you're going to actually start to push, sorry, not your left hip, your top hip. Got some left, some right. Squeezing your top hip, you're then going to start to push your top thigh down into the block or down into that pillow. So thinking top thigh, pushing down into the pillow or block. Then you're also going to start to push your top foot down into the block. And although you're using your foot to push down, I want to see if you can initiate that push with your foot with your hip. So you're actually using your top hip to push down into the block and push your foot down into the block or chair. And just do that nice and light to start. Maybe 20% effort. Just try to feel those muscles working. And we're in this internally rotated position with your foot up high. One thing you can also think about as you squeeze the block and push your foot down is almost like you're trying to externally rotate your hip. So it's like you're trying to rotate your hip through so that your foot pushes through the chair. And as you're trying to squeeze that top hip out, rotating and pushing down, find a contraction that you can sustain. So maybe it's 20%, maybe it's 40%. Maybe if you want to go up and squeeze a little bit more contraction, you could go up to 60. You could go up to 80 if you really wanted to. You could squeeze and push as hard as you can. But whatever contraction you're at, find your safest, greatest effort there with your top hip, trying to push down with your foot and down with your thigh into the block. We're going to hold that for 10 more seconds. So you're just thinking of trying to rotate your top hip externally through the chair. Keep that going another couple seconds. And then keeping that space between your bottom abs and the floor, you're now going to reverse it. You're going to switch gears and try to internally rotate your top hip as if you're trying to lift your top foot off of the chair or block. Keep your knee on the block and keep just thinking about rotating your thigh internally so that your foot would then therefore lift off of the block or chair as a result. We're going to squeeze that, and this is where a little cramping may come into play here. See if you can squeeze a little more rotation so that your foot either gets lighter on the block or perhaps even lifts. It's okay if it doesn't lift. Just attempt to try to rotate your thigh to lift. Let's go for 10 more seconds there. Keep rotating. Try to feel those deep hip muscles spiral that internal rotation. Keep rotating, keep lifting. And then you're going to slowly lower your foot back down onto the block or on the chair. Take a couple big deep breaths here. And see if you can even create a little more space now between your bottom side abs and floor. So just trying to create that little tunnel between bottom abs and floor. As you're relaxing your hip, slowing your exhale down, just trying to find a little bit more space between your bottom abs and the floor. Take one more big deep breath. And then from there, guys, we're actually going to move the chair out of the way and you're going to be in the same position. So if you want to either just move back or just slide your chair away, You're gonna stay in the same position here with your hips, knees, and ankles stacked. You're gonna still maintain that little bit of space between your bottom abs and the floor. And then from here, we're gonna do internal rotation liftoffs. So holding that space steady, you're gonna spiral your top thigh internally so that your top foot lifts up towards the sky as a result. You're gonna go as high as you can go, find your end range there, see if you can squeeze out a little bit more height. And then imagine your foot as a parachute. You're gonna take 5 seconds to slowly, under control, lower your top foot back down onto your bottom foot. Excellent. Good work, guys. Once your foot hits your bottom foot, same thing, keep that space. Rotate your top thigh internally. Your top foot will come up towards the sky as a result. Same thing, see if you can squeeze that block a little harder with your thighs and try to lift that top foot a little bit more through your hip. Keep squeezing, fighting for a little bit more range, and then slowly parachute foot down. Taking your time, feeling the hip control your foot all the way down. And then we'll go one more rep, guys. Same thing, squeeze that block a little bit tighter, a little more space between abs and floor. Find that side of your butt, front of your hip, and rotate, squeeze. Find that end range, fight for a little bit more rotation at your hip. And then slowly take 5 to 10 seconds to lower your top foot all the way down. Once your top foot hits the bottom foot, go ahead and relax. Excellent work, guys. Take a quick little breather and we will switch sides, catch up your other hip. How'd that feel? Feel okay? Did I hear pretty intense? Yes, you're doing it right then. Nice job. Tanya, I know you're muted and no screen, but I didn't forget about you. I hope you're doing okay. So guys, same thing. And although we're kind of same body, we might have a different hip on the other side. So definitely feel free to take your time, bring that block between, and before you go up onto the chair, take that just second to do a test rep and just see how high you can get your foot as a result of the internal rotation of your hip. You might find it's the same, maybe it's better, maybe it's a little worse. Doesn't really matter. It's just where you're at today. And we'll just kind of find a good spot for you. So again, whether it's just your foot up on the chair or your foot up on the block, you want to just find something to get you up a little bit higher than where you can actively move into to be able to just set your foot on top of and be able to relax into this position. So that we want to be strong in this internally rotated position of your hip. Also want you to be able to relax into it. Just letting your top knee relax on the block, letting your top foot relax on the block or the chair. Just using slow breath in and even slower breath out, and letting your right hip just relax. Letting your right hip, I keep saying rights and lefts, your top hip, letting your top knee just relax onto the block. Take 2 or 3 more breaths here as you just relax your top hip. Again, if it helps you to feel those muscles, feel free to close your eyes. You can bring all your attention into the deep hip muscles, right into the hip socket of your top hip. And you're just going to contract those just a little bit. Just try to feel those hip muscles contract. And then once you feel like you're able to contract those hip muscles, use those to start to push your top thigh down into the block and push your top foot down into the block or into the chair. Same thing, you can start with a very light contraction. And then once you feel like you've got that contraction under control, you can hold it consistently. Feel free to work your way up do a stronger contraction where you're pushing your foot down into the block harder. You're pushing your top knee down into the block harder. And you're just thinking like you're trying to put a dent in the chair through your foot with your hip. And if it helps to think of, you're almost trying to externally rotate your hip, like you're trying to drive your foot through the chair, using your hip muscles to do that. We'll hold that for 10 more seconds. Nice and strong contraction. Pushing down harder with your knee into the block, harder with your foot into the chair. Holding that your safest, greatest effort. And then we'll switch gears, same thing, keep squeezing the block with your knees, but now try to rotate your top thigh internally as if you're trying to lift your top foot off of the chair or block using your hip. If it helps, even think about keeping your top foot almost as dead weight there. That may help you feel your hip a little bit more. No, it feels a little crampy. Keep trying to squeeze. I know it sounds crazy, but the ideal spot here is to almost find a cramp and try to squeeze through it, but don't feel like you need to do that right now. If you can just get some shaking in your hip into your leg, that's even better. Go for 10 more seconds there, guys, trying to fight for a little bit more height with your foot through your hip muscles. And then slowly relax your top hip, let your top foot come back to the chair or the block. Take a couple big deep breaths there. Use your slow exhales to relax everything. Maybe creating a little more space between your bottom side abs and the floor. You can almost do like a side crunch there if you can get it. Go one more big deep breath. Excellent. And then we'll go ahead and either scoot the chair away or you could move your whole body back. Just want to get a little bit of clearance for your top foot as we start to rotate your hip for 3 reps. Doing okay, guys? Cool. Looking good. So same thing, guys. Create that little bit of tunnel between your bottom abs and the floor. Keep your pelvis stacked. And then from here, you're going to slowly rotate your top thigh internally, and your top foot will lift as a result of what's happening at your hip. And same thing, you're going to find your end range of that, fight for a little bit more. See if you can get higher than you did on that just previous set there. 5 more seconds of squeezing out those hip muscles. And then you're going to slowly parachute your top foot down. And everything, although I'm cueing the foot and low leg, everything's being initiated at your hip. Once your top foot hits your bottom foot, same thing. Keep that tunnel between your bottom abs and floor and rotate your thigh internally. Foot goes to the sky as a result. Find your end range of your hip. Fight for a little bit more. Feel free to have your foot and lower leg as dead weight if that helps you feel your hip more. And then slowly lower back down. Excellent. And then we'll go for 1 more rep here. Good tunnel between bottom abs and the floor. Find those hip muscles and use them to rotate your thigh internally. Top foot lifts towards the sky as a result. Rotate, rotate, squeeze that out. Last one, best one right here. So you can get a little more height. And then slowly lower top foot back down and relax from there. Excellent. Awesome work, guys. That is some internal rotation work there. We're going to switch gears and get into a little bit of some external rotation. So couple options on this, and I will demonstrate those so that everybody's got a variation they feel comfortable with. The first option is, and this would be if you felt like you're pretty restricted in external rotation of your hip, you could lie on your back and actually cross your foot over your opposite knee and then stiff arm your knee away from you so that you feel a stretch into your glute. on that side. This is option 1. And then option 2, if you feel like you've got a little bit more range of motion at your hips, you could actually come into this, we'll call 90-90 position. So it's kind of a pigeon pose-esque position here. And knees don't have to be right at 90. You could bend your knees. That may make things a little easier here. But from this position, to find the stretch in your glute, you'd actually poke your tailbone back this direction, and that will pull your glute onto stretch. So when you're here, by poking your tailbone back, lifting belly button and sternum, you should be able to find a stretch in that front glute. So let everybody kind of find that a little bit, and I will make sure everybody's got a good stretch into their hips before we kind of get into the sequence here. But glute stretches, got them. Okay. Guys, you got them. Glute stretch, feeling it? Awesome. Perfect. So what we're going to do is, as you stick your butt back and you feel that stretch right into the glute butt cheek there, you're just going to breathe into that. And the more you can stick belly button and sternum up, and almost like a string is attached to this hip, and that string is pulling your thigh into the back of the socket to the back of the room, that should then give you even more stretch into that glute. Awesome. Morgan, got it. That's all right. That's what I'm here for. Once you find that stretch, just breathe into that. We're going to hold there for about a minute or so. That's what I'm here for. I got you. So see if almost like your glute here is pulled. Yeah, there you go. And then you could lift up and over, lift your sternum up a little bit more. You need to keep your hip on the floor there though. Yeah. You feel that stretch in your left kind of glute area there. Perfect. And that's it. You're just going to hold right there. Awesome. So I'm here for it. Don't be afraid to ask. Awesome. Okay. So now that we're in this stretch, we're going to hold this for another about 30 seconds, and I'll kind of go through the cueing on this here. But we've kind of wound your hip into external rotation. What you're going to do is, whether you're on your back or on the floor, if you're on your back, keep your hand on your knee like you're trying to stiff arm your knee away from you there, and that'll kind of block that position. And then what you're going to do, and I'll kind of go through this first, if you're in the position I'm in, you're going to think about using the muscles that you're feeling stretch to push your entire leg into the floor. So it's like you're trying to make a dent in the floor with your shin, your knee, your thigh, but using your hip muscles that you're feeling stretched to do that. If you're here, then what you'll think about doing is pushing your foot into your thigh and your knee into your hand without actually getting any movement. So you almost are thinking of like you're trying to internally rotate your hip, but you're blocking any of that from happening. Okay. So we'll start that contraction now. Wherever you're at in this glute stretch position, you're going to start to very lightly, if you're in my position, contract those muscles you're feeling stretch, and start to push with those muscles your whole leg down into the floor. Mary, for you, it would be trying to push your right ankle into your left thigh and your right knee into your right hand there, if you're lying on your back. And just get a light contraction to that. Feel that glute working to push your leg into the floor or into your thigh and hand. Once you feel like you've got a pretty good contraction into there, start to work your way up with a little bit stronger contraction. So start to push a little bit harder into the floor. And it's like you're trying to make a dent in the floor with your thigh and your shin using those muscles you were feeling stretch. Take 10 more seconds to kind of work your way up to your safest, greatest effort. More contraction of that hip that's feeling stretch. Keep squeezing, and then whatever contraction you're at, hold that strong for another 15 seconds. Keep pushing down into the floor or into your thigh and hand. And then without moving, you're actually going to switch gears. Keep your body position the exact same. Now, instead of contracting that glute to push down, you're going to try to contract your inner thigh as if you're trying to lift your shin and thigh off of the floor without leaning back. So it's not going to happen. You're not going to be able to lift your leg off the floor, but you're trying to squeeze and lift up. So we'll get a good 20 or 30 seconds of that contraction. And you're trying to feel kind of deep groin, deep inner thigh, trying to lift your leg off the floor. And as you're doing that, you could even think about poking your tailbone back to even try to find more stretch in your glute. So if you're on your back, it'd be trying to create more space between your low back and the floor. If you're in this position, you're trying to pull your butt to the back of the room as you try to lift your leg with your inner thigh. See if you can squeeze your inner thigh out a little bit more for the last 10 seconds here. Keep trying to find that deep groin, deep inner thigh, squeeze, trying to lighten your leg off of the floor. And then you're going to stay in that position. Relax your hip completely. Take a couple breaths, and you should feel like that stretch actually dissipated a little bit. So from there, come into a little bit deeper stretch. Maybe it's poking your tailbone back more. If you're on your back, creating more space between your low back and the floor. If you're in this position, maybe it's just poking tailbone back more, lifting belly button and sternum, and even hinging your torso forward a little bit. That may give you more stretch there. Once you find that stretch again, take a couple big deep breaths. Slow exhales. Excellent. And then slowly take your time, come on out of that position and relax. We are going to switch sides, catch the other hip up. How'd that go for everybody? Okay, got the cues down? Feel like you know what you're doing, Morgan? More or less. So take your time. Mary, on your back, that go okay? Okay, cool, awesome. So we'll switch sides, and I'll do this one on my back just to kind of give everybody a little bit of an idea of what both look like. So you're going to go same thing on the other side, finding that stretch. So again, if you're on your back, poking tailbone into the floor and pushing your knee away from you, that should give you that good stretch in your glute there. Again, if you're into the kind of this 90-90 position, belly button, sternum lift, and you're trying to poke your butt to the back of the room and find that stretch in your front glute there. Once you find that stretch, you're just slow breath in, even slow breath out. Another way you could get more stretch from this position is actually rotate around your top leg. That'll allow you to pull your thigh to the back of your socket a little bit more, give you more stretch there. Excellent. If you're on your back, another way you could get more stretch is just pushing your knee away from you a little bit more, even bringing your foot closer to your butt on the foot that's on the floor. That'll give you more stretch. A lot of this though is just poking your tailbone, poking your butt to the back of the room. And that should just right off the bat give you that stretch. How we feeling, guys? Everybody got a stretch? That's okay. I'm good with that. Yeah. For you. Oh, okay. That's okay. So what I would do there, keep breathing through that stretch, guys. What you could do is actually just set your foot on top, like your heel on top. That may, how's that? So that way you don't have to work. It's still not a stretch until you pull in. That's okay. Go ahead and grab your, you can grab your, like on the walls, another variation that you could do, but you could do that. That'll totally work. Yeah, so what I would do here is actually just bring your knee forward more on this side. Yeah. Okay. And then see if you can poke your butt back a little more. Is that better? Is that better? Nice, perfect. That's a good spot for you then. Yeah, absolutely. So from here, guys, we're gonna get into those contractions. So you're gonna start to squeeze those muscles that you're feeling stretch in that glute. Just squeeze those and just feel them contract. And then when you feel those muscles start to contract, use those same muscles to start to push your thigh, your knee, your shin, your ankle into the floor, like you're trying to make a dent in the floor with those muscles that you were feeling stretched that are now contracting. Again, start nice and light. And then if you feel like you can contract lightly and sustain that, feel free to work your way up to like you're trying to max out, pushing through the floor if you wanted to. Anything in between light to as hard as you can go. Find that contraction that feels like you can hold consistently. If you're on your back, you're trying to push your foot into your thigh and your knee into your hand. Hold that for 15 more seconds, that contraction, just feeling that deep hip work to push into the floor or into your hand and thigh. Good. And then stay in that same position. Try not to move anything. And instead of contracting the outer hip that you're using to push down, now you're going to try to find your inner thigh and groin and attempt to lighten your thigh and shin off of the floor. It's like you're trying to lift your leg into you. It's not going to happen, but just trying to feel those muscles work as if you were trying to. The deeper groin you can feel on this, the better as you try to lift your leg off of the floor. You could even try to poke your butt back even more to get more stretch into that glute as you contract that inner thigh groin. 5 more seconds of trying to lift that leg, keep that contraction consistent, and then stay in that same position. Relax your hip completely. And that stretch should have dissipated a little bit. So you may need to then either poke tailbone back a little bit more, maybe get that rotation over if you're in the seated position. Maybe bring, if you're on your back, you may need to bring your foot closer to your butt and stiff arm your leg further away from you. Whatever gets you that stretch again. And you're just going to take 2 or 3 more big deep breaths into that spot, into that new range of motion that you just acquired by those contractions there. Nice slow breaths. Excellent. And then we'll slowly take your time, come on out of that and relax. Awesome. Was that one intense too? Nice job. Everybody felt their hips working? Yeah, nice. Awesome. Good, good. So guys, we're going to finish with a couple more drills. If you want to grab your block for a pillow here, you're going to lie on your left side. I should probably just give everybody the side that I'm going to work on. So I'm not saying left instead of left rights and all that. So let's lie on our left side. We'll get this down here. And again, you could have a block for your head, but what you're going to do is completely stack your shoulders, hips, knees, and ankles, and your knees will be bent to about 90 degrees. Doesn't need to be exact, but something around 90 degrees. And then we're going to kind of go into the same thing. We're going to tie in our rotations, both internal and external. And we're going to do these rotations that we started with today, just from a different and harder position, basically. So what you're going to do is pull your left side abs up away from the floor a little bit. Find that little bit of a tunnel. That's going to help your pelvis stay locked in. And from here, you're going to slowly bring your right knee up towards your chest, but take your time on that and only go as far as you can keep your low back and pelvis motionless. So eventually you're going to get to a point where you kind of run out of hip and your low back and pelvis compensate to get you there. I want you to stop right before you get to that point. And what you should feel is kind of the front of your hip really working on this kind of front hip crease there. If there's pain and pinching, just back out of it a little bit. Don't go as far. And then keeping that tunnel between your left abs and the floor, you're going to use your right outer glute to start to lift your right knee, thigh, shin, ankle. The whole leg's going to come up to the sky. And it may feel a little limited if you keep that space between your abs and the floor. Same idea, when you run out of room, the pelvis is going to want to compensate and lose that space. So keep that space there. And then from here, try not to let your knee drop. you're gonna spin your thigh to internal rotation. Your thigh spins inward and your foot's gonna come up as a result. Good. And then same thing, keeping your knee high, you're gonna rotate your thigh to external rotation and your foot's gonna kind of sweep forward. And see if as you do that, if you can lift your knee a little bit higher. Nice. And same thing, keep your knee right where it's at. Rotate internal rotation. I know the side of the butt's burning like crazy. Hang in there. Rotating, foot comes to the sky as a result. And then slowly control external rotation. Same thing, feel the deep hip. Again, if you want to just let your foot hang dead weight, that's totally okay if it helps you feel your hip more. As you rotate external, see if you can get your knee a little higher. And then one last rep each direction. Spiral that internal rotation. Keep your knee high. Keep that left side ab space. Rotate, squeeze out a little more. And then one last external rotation. Slow and controlled. Feeling that deep hip, rotate your foot down. Fight for a little more. And then slowly lower right leg back down. And relax and switch sides. Awesome, guys. Everybody gonna be able to walk out of here? Nice job, guys. Well done. Last thing of the day right here, and then we'll get a few minutes of breathing in and call it a hip class here. So same thing, lying on your right side, shoulders, hips, knees, ankles, all stacked. I'm gonna create that little bit of space between your bottom side abs and the floor. And then keeping that space, maintaining your length through your tailbone and your low back, you're gonna slowly start to bring your left knee up towards your chest. And same thing, go nice and slow, only go as far as your low back and pelvis can stay out of this movement. And then your outer hip's gonna work to lift your whole leg up to the sky, only going as far as you can keep that right side tunnel. And then from there, try not to let your knee drop, spiral internal rotation at your thigh. Foot's gonna come up to the sky as a result. Feel that deep hip rotate. And then slowly back to external rotation, thigh spins out. Foot's gonna come down as a result. See if you can get your knee even a little bit higher. And then back to internal rotation, slow and controlled. Feel that hip contract, control that movement, find your end, squeeze out a little more internal rotation. And then slowly back to external rotation, thigh spins out, foot comes down. Same thing, see if we can get the knee a little bit higher. And then one more time, spin internal rotation, deep hip, thinking side of the butt, working to spiral your foot to the sky. And then last external rotation, drive the knee high, rotate the hip so your foot comes to the floor, squeeze out a little bit more, and slowly lower down and relax from there. Awesome job, guys. Go ahead and find the most comfortable position you can come into. Get a couple minutes of some breathing in. Nice job. How we doing, guys? Feel all right? Awesome, awesome. Hello, hips. Nice work, guys. We'll get a couple minutes of just some relaxed breathing. So whether you want to lie on your back, you want to lie on your stomach, you can sit cross-legged, say most comfortable position you could come into to get into a good relaxed position. We're just going to start with a very silent and slow inhale in through your nose. Trying to make that inhale as silent as you can. And then you're going to exhale. As you exhale, you can go through your nose or through your mouth, but try to keep your exhale very slow, very relaxed. Each inhale, you're thinking of getting maybe a little bit more air in, although trying to keep that inhale silent. And then each exhale, slow, relaxed, but see if we can make that a full exhale. A lot of us don't actually exhale even close to the amount of air in that we inhaled. So seeing if you can elongate your exhale a little bit more, like once you think you're out of air, see if you've got a little bit more left to exhale. Still trying to maintain that balance of not gasping for air on your inhale. Still want the inhale to be silent. And as you're inhaling, give you another thing to think about here. Try not to use your neck at all on your inhales. Sometimes it can help to like bring a hand or two on your neck to just kind of feel if your neck is tensing and working on your inhale. Oftentimes it is. We want to try to get out of your neck so that when you're inhaling silently in through your nose, your neck isn't helping to get more air in. It's staying relaxed. And then as you exhale, see if you can relax your neck even further. You could even think about relaxing everything from your neck, your jaw, your face, your shoulders. Imagine as you exhale, all those muscles are getting heavier. It's like they're melting into the floor. Trying to maintain that relaxation of your neck as you inhale. Every breath just getting more relaxed from your shoulders up. It's almost like all those muscles that would work to try to lift your head off the floor from this position are relaxing even more so that your head gets heavier into the ground. Then you could use that same idea of consciously relaxing your neck, your face, jaw, teeth, skull, eye muscles, shoulders, and take that to maybe some other areas of your body that you feel like you might be holding on to some tension. Bring all of your attention to that area. As you exhale, just consciously relax that area. Let it get heavier into the floor. You could even imagine like you're breathing air into those areas that feel tense and tight and stiff. Breathe air into those areas, and then as you exhale, those areas just get heavier and relax even further. And then for this last about minute of breathing or so, see if you can start to slow your exhale down even further. Ideally to the point where your inhale is about half the amount of time as your exhale. So maybe you're taking a 3-second inhale. Try to make your exhale 6 seconds. Maybe it's 4 in, 8 out. Maybe it's 5 in, 10 out. 2 and 4 out even is okay. Just trying to slow your breath down, in particular your exhale, which can be really helpful when we're stressed, anxious. Just being able to be present with your breath. It's a nice, easy way to get present with God. As you slow your exhale way down, start to kind of activate that part of your nervous system that's the rest and digest part of your nervous system. Circulation slows, everything kind of slows down. Get away from that fight or flight. About 3 more breaths. Each exhale, trying to get a little bit slower, a little bit more air out. May even get to the point where you feel like you can hold your breath at the end of your exhale. Still be very relaxed. Maybe it's 3 seconds, 5, 10. Since we've been in the breath for a good 5 minutes here. You can start to bring a little attention back to your body. Maybe it's just feeling your body in contact with the floor. Do a little wiggle of fingers and toes. Rotate neck side to side. For those of you that are still awake, that's a wrap today. Awesome job. Thank you all for joining, either in person or virtually. It's great to see everybody and be able to guide you through this hip class. I have recorded this, so I will definitely be sure to send this class recording out. Some of those contractions that we did, and I'll say this in the email too, but those contractions, just like you're exercising, you wouldn't necessarily do, bicep curls every single day. Same with these contractions. You don't want to like train your hip with hard contractions every day. The cars every day, yes, for sure. When you're working some of those contractions 2-3 days a week can really be a game changer. So I'll send all that in email, but and I haven't decided what we're going to work on next, but I do have everybody's requests in. So I promise we'll get to everything everybody wants to hit over the 8 weeks. Thank you all again for joining, and we'll look forward to seeing everybody next week. God bless. Thanks, guys. Thanks, Tanya.
Thank you.
Actually, yeah, back table would be